It is Wellness Wednesday, and May is Women's Health Month. This morning, we're breaking down the top 5 screenings every woman should be staying on top of. We've got Dr. Asma Ahmad with Healthy You Clinics joining us now to walk through really what matters most and also when to get tested here. Okay, so Dr. Ahmad, what are those most important screenings women should be focusing on?
So I would say the most important screenings are going to be number 1, breast cancer, which we begin at age 40 and do annually. Number 2, the screening for cervical cancer, which is going to be Pap smears. And we begin that at age 21. Most women are familiar.
Yes, but some not, so good to let them know.
Very good to know. And colon cancer screening, very important, age 45. And then I like to also focus on metabolic screening. So for example, blood pressure screens once a year, cholesterol lipid screen, and also an A1C. Heart disease is still one of the top killers of women, so very important to focus on that.
Yeah.
Apart from that, we have like the bone density, which is DEXA. We'd like to get that at 65 and above.
Okay, so blood pressure, cholesterol, diabetes, and then we've got all the recommendations here on your screen. So come take a look, maybe take a picture of this so you keep it with you the next time you go to the doctor. You can talk them through this. I want to focus on the mammograms here. What is the current recommendation as far as kind of how often you should be going, what you should be looking for? I guess I really just want to focus on kind of the early detection part of this.
For sure, 100%. So United States Preventative Task Force actually had the recommendation come out in 2024, which recommends beginning the screening at age 40, which is so crucial and so important to save lives. So most experts agree that we should do annual screening. So it's going to start at 40, we go annually, and then later on you can discuss with your physician if you'd like to go every other year if you've had normal mammograms until about the age of 74.
Okay. So I kind of want to focus on colon cancer as well here. This is something we have been seeing, I think, more and more, at least in headlines. Some celebrities, you know, dying from this. Think recently James Van Der Beek from Dawson's Creek,
yes.
And others as well. And it just seems like it's happening in people who are younger, not necessarily that older population anymore. So let's talk about the early screening, you know, for that and kind of why recommendations changed a little bit there.
So yes, we used to screen at 50 and now we screen at 45 for the exact reasons you mentioned, that people are just getting diagnosed earlier and earlier with different risk factors, whether it's family history, whether it's diet, different risk factors causing early colon cancer. So we do say 45, but if you have a first degree relative, we actually recommend 10 years prior to that.
Oh, wow.
10 years prior to the age of the age that relative was diagnosed.
Okay.
So that will help catch a lot more colon cancer.
Yeah, because I mean, the symptoms of colon cancer, they can be easily missed from what I've seen. And if you can explain some of those, people just don't, it's like you don't find it until it's too late.
Yeah. I would say if you're having any change in your bowels that's just not going away, for example, you're having, you know, you never had constipation, all of a sudden you're constipated, you have very thin stools, you're having blood. And these symptoms, sometimes, you know, people can have that 1 or 2 days.
Sure.
But if this is something that's ongoing, your bowel habits have totally changed, and it's ongoing, you've done the basic things over the counter, then I would say get seen by your physician and get checked out. You may need a colonoscopy.
Yeah, absolutely. Let's talk those metabolic numbers that you were talking about earlier, right? Blood pressure, cholesterol, diabetes, knowing those numbers is so important for anyone. But why specifically for us women? Why should we know those numbers?
So heart disease is, you have to remember, still the #1 killer of women overall.
Yeah.
So that is going to be the main push for that. I would say blood pressure yearly, you need to pay attention to that. The cholesterol panel yearly, and the A1C, because all of this kind of walks, the metabolic diseases walk hand in hand together. So insulin resistance, diabetes, all these things kind of walk hand in hand. So it's important, that annual physical that a lot of women put off is very important for that reason.
Yeah, absolutely. I mean, just knowing that, you know, I partnered up with the American Heart Association just last week and talking about how heart disease is affecting women every day. It's not the #1 killer, but there are some things that we can do. If we wanted to make a habit change, maybe tomorrow, for any of these, you know, diseases that we talked about, what would you say is one simple step that we can change in our routine tomorrow?
I would say that the #1 thing that well, the 2 things I would say is really American diet is very high in processed and sugar and carbs. So if we can kind of get rid of, I would say the more you can focus on your diet, improving the diet, decreasing processed food, decreasing sugar, and bad carbs.
Yeah.
So that means things without fiber, like just chips and cookies. Also walking, moving. 150 minutes is American Heart Association recommendation across the week, and 2 to 3 days of weight training. Women also forget to weight train.
Yeah, and
Very
you
important.
need to, build your muscles, keep your bones healthy, all the things. All right, Dr. Ahmad with Healthy U Clinics, thank you so much for being here and walking us through that. Hopefully you got a picture of those recommendations that we have so we can all stay healthy. Thank you.
Thank you.
And thank you.